You know, there's a lot of people out there really making their best effort to lose weight. They really are. Sometimes they don't know. They're doing the right thing for the wrong reasons, the wrong thing for the right reasons, perhaps. What are they doing wrong?
Well, unfortunately, most of us are not at all thinking about our hormones when we're trying to lose weight. And if you really understand the process of weight loss, it's all about your hormones. They're actually dictating every single aspect of your ability to lose weight.
And so I made it my mission in my practice as a naturopathic doctor to make sure that so many patients don't go through the same thing that I did.
We're plagued with the symptoms of hormonal imbalance every day, yet we ignore them. If you feel tired after eating, if you have cravings, if you feel hungry on the diet that you're following, it's not the right diet for you. So many of us, here's the catch, is that we're choosing diet and exercise programs that are actually perpetuating the hormonal imbalance that's making us gain weight. What do we do when we want to lose weight? We skip meals.
Yes.
We restrict our calories.
We starve ourselves.
Those two things immediately, it drops your metabolic rate. And
we should never be hungry.
Never be hungry. I had a patient in my office last week. He looked at me and he said, Dr. Turner, I cannot believe it. I have lost 40 pounds since January and I've never once been hungry.
Classic symptoms would be difficulty losing weight, even with diet and exercise. It would be weight gain in all of your favorite places, like collecting on your hips or your thighs or your abdomen. Those are classic signs of hormonal imbalance. Or feeling fatigued after eating, or difficulty sleeping, or not waking up as refreshed. Those are the subtle signs and symptoms that we all develop, and most people ignore them. And then I cannot believe the number of people that have come to me since I've written this book and said, oh my goodness, this is me. I have this. I thought that was normal. I thought it was part of aging. And it's not.
I start the whole program in the book with a detox diet.
Yeah, I was going to ask you, detoxification, it sounds like it could help
huge.
her. It's
It'd be
easy.
so important. And we remove all the foods that could adversely affect her skin, cause bloating, swelling, water retention, as well as digestive upset.
Detox sounds like new age vagary. It often does. You know, what's happening when we detoxify, when we help the liver along? How is that working to balance estrogen?
There's actually metabolic pathways in the liver involved in breaking down and eliminating estrogen. And so you can give vitamins and supplements and nutrients to increase the activity of these pathways.
Excellent.
Example is magnesium is an incredible estrogen detoxifier, calcium deglucarate, and these are all the ingredients that I put in the pack, so it's so simple. The thing is, your timing of your meals and the combination of the foods of your meals can boost your fat-burning hormones or inhibit them. Your sleep is one of the most important fat-burning potential and hormone-enhancing activities that we have.
You need to get your sleep.
So I teach you how to do all these basic things that we know we need to do, but do it in a way that you enhance your hormonal balance for fat loss. I teach you how to recognize stress, because many of us have absolutely no idea that we are stressed, so the particular signs and symptoms. And then what you can do, I teach you how to eat, how to sleep, how to exercise, and the right amount of sex, the right amount of skincare, all this stuff to help reduce the amount of stress on your body. So you actually should start thinking about your stress first. I teach you in the hormone diet how to eat the right foods at the right times to actually boost your metabolism so that you lose weight almost effortlessly. Again, we have to go back to the philosophy that your hormones are dictating your ability to lose weight. It's not your exercise alone. It's not your diet alone.
Right.
I really believe that word is just starting to get out about the concept. We're totally in a new era of weight loss. And that whole antiquated equation of calories in minus calories out equals weight loss, it isn't true. It doesn't work. People aren't thinking about their hormones, and the piece of the equation you have to add in is hormonal balance plus the difference in your calories. That's what equals weight loss. I actually put a whole chapter on testing because I think it's so important and it's so empowering if you know the tests to ask for. So it's a big topic, and I think the easiest thing to do is to look at the reference that I put in the appendix of the book, and it outlines all the hormones that you can test and the perfect range for every hormone, and actually what you can do to restore balance for that particular imbalance.
Wow, and just in case there's, men out there watching going, oh, they're talking about this for women. It's not, is it?
It's not. It's actually the first book on hormones that's for both men and women at all ages and all stages of life. So you're going to want to have this book on your shelf and refer to it time and time again, because as you age, your hormones change. And you can use the book to bring you back in balance no matter how old you are. I help you first recognize the signs and symptoms of imbalance. I help you understand how that's impacting your ability to lose weight. And then I spell out the hormone diet 3 steps that helps bring you back in balance so that you can recognize the signs and symptoms and then lose fat, gain strength, and live younger longer.